Major surgeries are on the rise, with growing figures like total knee replacement said to increase by 90% until 2030. Access to healthcare has never been greater, and with it, the need for affordable and effective healthcare technologies.
Approximately 10,000 people a day turn 65. The majority of those 10,000 people lived a fairly active lifestyle, which tend to help wear out the joints, and the majority of those people also have qualified for Medicare, which pay for total joint replacement. After the patients do have their joints replaced, one of the crucial things that is needed for a positive outcome is a good therapy program. And part of a good therapy program is CPM, or continuous passive motion, which allow the patients to rehab their joint without the presence of a physical therapist.
I found myself on the way to rehab. I was quite nervous. I'm putting my life in the hands of somebody that I don't know, and I don't know what they expect of me, and I don't know what to expect of them. But I have the fear that it's going to more or less be painful and something I really did not want to deal with, but I knew I had to. And I don't know what they're going to do to me. Are they going to make it better, worse? Is it going to be more painful? Is it not going to be painful? So there was a lot of anxiety that I found in going there.
In today's healthcare climate, there exists a greater need for communication and monitoring of patient compliance by their therapy team. Patients benefit from increased communication with their rehab team. This allows the rehab team to monitor patients' progress and adjust therapy remotely while reducing costs.
For the patient that's unrehabilitated or under-rehabilitated, we worry about overall a slower recovery, less patient satisfaction, poorer motion. We also worry about other complications such as blood clot. And in the worst case scenario, if a blood clot would break off to a patient's lungs, that's called a pulmonary embolism, which unfortunately can be even fatal.
Delivering a suite of products to help improve patients' well-being, Kinetec's focus is on encouraging early passive mobilization and facilitating communication between patients, surgeons, and therapists.
I am a huge advocate of patient engagement. What does engagement mean? It means that they're fully knowledgeable about what they're going to go through, and they become an active participant in the whole experience. I, as a provider, as the orthopedic surgeon, want to have as much information about the patient and their experience on a real-time basis. Currently, healthcare is very episodic. I see the patient in clinic, I see how they're doing, I'll see them back in 1 month, next episode when I see them in follow-up. But really, to improve outcomes, I think that if we dynamize the process and have real-time information, we can respond immediately to improve their experience and their outcome.
The Kinetec Kompanion is a marvelous piece of equipment. It relieved the pain and stiffness in my knee, and the app was really simple to use and very self-explanatory.
Kinetec is a global manufacturer in medical devices. The business was started in the 1970s and launched the CPM continuous passive motion devices into the USA in the 1980s. The key focus for all our staff is to make life a little bit easier for our patients. Part of that development for the companion product was introduction of tablet technology, where we're able to monitor remotely the patient. We're able to create a companionship loop between the doctor, the physiotherapist and the patient. And that data allows the patient to be motivated and monitored as they progress through their rehab. And a motivated and monitored patient will tend to perform much better during that process.
Continuous passive motion is the key to successful post-op therapy. With a history of improving physical therapy outcomes and providing sustainable, cost-effective solutions, Kinetec is now bringing physical therapy into the future so that continuous passive motion is something that all parties engage in.
We need to improve the way and change the way we provide care. Hospitals are filling up. There's certainly been a huge trend to decrease lengths of stay, decrease the rates of readmission, and something that can really help to achieve those goals is technology. CPM monitored program can certainly make a huge difference and allow us to monitor a larger number of patients, provide them with really a better outcome, and at the same point still potentially drive down costs.
Kinetec has recently introduced the Kinetec Kompanion continuous passive motion machine. And what the Kompanion does, it allows the therapist and the physician to remotely access the patient, sending protocols, tracking compliance, all of which lead to better outcomes for the patient. The Kinetec Kompanion is just one of many products that have been introduced or will be introduced in the very near future that make it easier for physicians and therapists to treat patients and to provide better outcomes for those patients.
At Kinetec, we believe it's very important to support the patients to ensure that they gain some degree of independence during their rehab process. Our set objectives are service levels. We aim to have the best-in-class service levels. We aim to make products as environmentally friendly as we can, and we're really committed to bringing technology to the rehab market to make life easier for patients and more flexible for the doctors.
Kinetec puts patients first. Contact us today.